today we are going to talk about a rare disease which is called Castleman's disease. It's a very rare disease characterized by non-neoplastic lymph node hypertrophy. Its incidence and reasons are unknown. It has been found in association with Kaposi sarcoma, thus necessitating investigations for treatment. Although its localized variety is benign, other types of it can be multifocal with adverse systemic features.
A case report was found that a 42-year-old female presented with a history of slowly growing mass in her left iliac fossa. For 2 years, she was largely asymptomatic except for occasional discomfort around the mass. Her past medical and family history was non-specific. On examination, a non-tender worm was palpated, but there was no generalized lymphadenopathy or organomegaly. All her blood results were normal, including those for abnormal hormone production. A MRI scan revealed a highly vascular 6.6 cm times 4.6 cm mass laying just anterior to the left external iliac artery, possibly lymphoid in nature. A surgical excision of the mass was carried out under general anesthetic, and histopathology showed hyaline variant of localized Castleman disease. The patient was referred to hematologist. Tests for HIV and HHV8 were done. Both were negative. The patient remained asymptomatic 8 months post-operation with no further lymph node enlargement.
I'm gonna talk about the treatment. Once you have been diagnosed with the Castle disease, your healthcare team will discuss treatment options with you. Several different types of treatment can be used for Castleman disease, as like surgery, radiation therapy, corticosteroid drugs, chemotherapy, immunotherapy, and antiviral drugs. Your treatment options will be based on whether the disease is localized unicentric or multicentric, as well as other factors when these are important. Because Castle disease is rare, it has been hard to do studies to learn the best ways to treat it. Of course, no two patients are exactly alike, so treatment is tailored to each person's situation. Castle disease is a rare disease, so not many doctors have much experience treating it. If time allows it, it's often a good idea to sneak a second option. Getting a second option can give you more information and help you feel confident about the treatment plan that you choose. Your doctor should be willing to help you find another doctor who can give you a second opinion. As for conclusion, the aim of this discussion is to revisit this very uncommon condition and emphasize the importance of histology to see the diagnosis from other lymphoproliferative conditions, its association with Kaposi sarcoma and high prevalence of HIV necessitate investigating this condition. Thank you.
If your symptoms or the results of a test suggest you might have a lymph node problem such as CD, your doctor will want to get a medical history, including the details of any symptoms, possible risk factors, family history, and other medical conditions. The next doctor will examine you, paying special attention to the lymph nodes and other areas of your body that might be involved, including the spleen and the liver. Because infections are the most common cause of enlarged lymph nodes, the doctor will look at any infection in the part of your body near the swollen lymph nodes.
The diagnosis of the disease, the blood tests are likely to be done if the doctor suspected Castleman's disease, some other type of immune system problem, a serious infection, or other conditions. Some of the types of blood tests that can be abnormal in people with CD include complete blood count, interleukin 6, erythrocyte sedimentation rate, C-reactive protein. Having abnormal results for these lab tests doesn't prove someone has CD, because other conditions can also cause these problems, but these and other blood tests can help doctor make the right diagnosis.